Hello, everyone. It's a pleasure to be here with you today. I'm Everton, my colleague John Christensen. Um, First and foremost, we'd like to thank InterSystems for the opportunity offered to us to present. We have done this presentation on other user groups for other vendors as well. Just a little bit of class before I dive into our presentation. We are a research firm based in the US. We have been doing research on the healthcare IT space specifically for the last 25 years or so, over the last 7 or 8 on the non-US markets. Our traditional research has been rating vendors and helping healthcare providers to make better informed decisions through the research that we have done. So we have done published reports in different segments within the healthcare IT space. And one famous report that it's very covered for a lot of vendors. It's our best-in-class report. It's published once a year. So that's KLAS. It's just in a nutshell. Our main purpose in being here today is to talk about a new initiative, a new project that we started. About 2 years ago or so in the US, we had 6 organizations, health systems that approached us and said, KLAS, you have been great to us and to the healthcare community in facilitating our message to our vendors and help us to make better informed decisions when it comes to technology. But we really don't have a way to measure ourselves to know if our implementation, the time, the energy, the resource that we spent, was it worth it? Is it making a difference? And we don't really have a way to measure ourselves whether these implementations that we have gone through to see whether or not our physicians, our clinicians, nurses, doctors are producing and using the tool that we bought to its full capacity and how satisfied they are. So 2 years ago, the Arch Collaborative Initiative was born with the intent to measure, collaborate, and do a benchmarking around health systems that are working together in different EHR systems. So this is the Delicate Arch in Utah. That's where we're based, in southeast of Utah. And the idea is to connect one point to the other. And the Arch Collaborative aim is that, is to connect different health systems. It took us about 30 hours to get here to Bangkok. This is a cockpit from an airplane. When the aviation industry came out, and when I fly in an airplane, I expect that the pilot feels that the computer system that he's using, you'll bring me safely, or take me safely where I'm going. And one thing that we ask is, I love to ask the pilot, do you agree that your computer is enable you to fly more safely? I expect him to say, yes, absolutely, or else I wouldn't make it to my destination. And are you satisfied in using those systems? So think about the Arch Collaborative as a way to understand whether or not our clinicians are satisfied using their EHR. So what is it? What's the purpose for it? So today, it's an initiative that we have about over 200 organizations participating with us. Over 114 data points from clinicians that have participated in collaboration. We have launched this in 10 different countries. It's a set of questionnaire that takes about 5 minutes for a clinician to complete. And as we go through the data, we have built case studies to help a high-performing organization to share their best practices with other organizations throughout the world. We're doing seminars and summits as well. Our next ones will be in Salt Lake City and the other one in Portugal, focusing on non-US markets. The idea for these 200 plus organizations participating is to ask a standardized same EHR questions where one key question that we ask for them is, do you agree that your EHR enables you to deliver high quality of care? And that's the key question on this project. And we have learned that 45% of the organizations participating say that we do not agree. But why? A lot of this, each line, blue line over here, represents one organization. Each line representing an organization has one EHR implemented. The dots, the lines that connect different organizations, are using the same EHR systems. But why is it that you have high-performing organizations here and lower-performing organizations there if they're using the same technology? Supposedly, they're using the same tool, the same functionalities. But what's causing this variation? These are some non-US health systems that we have done the Arch Collaborative with. And as you can see, the variation is the same. Are you satisfied with your HR? We asked a group of physicians from the same organization. One said yes, the other one said no. And what are they doing different? What are these organizations doing differently on the top than on the bottom? What's causing the incredible variation? So we went out and asked them, do you believe that what you're doing differently from some of your peers that enables you to be highly successful? And this is our favorite one. And perhaps this is our second one. But in reality, where does this variation come from, guys? I like Harry's remarks that he was talking about change management. That's one of them, actually. Change management is a key important factor as you look at the variation on high-performing organization, lower-performing organization. And historically, healthcare providers have blamed a lot of their vendors. It's my vendor's fault. It's the technology that doesn't work, or it's the relationship that's not working. But in reality, we have learned that only 22% of EHR vendors is to blame for the variation. The majority is within the organization. The governance, the culture, there has to be a collaboration between the clinician and the IT. They have to be sync. That synchronization is key. It cannot be just an IT project. The medical team and the clinician team have to work together with the IT team. And the other one is the clinician users. That means is your education and training and customization. How customized is the tool to you to enable to deliver high quality of care? So with that, my colleague John Christensen is going to be really talking what really drives the satisfaction. And he's going to talk some of the data points to the golden path, I guess, where we'll help you to better understand how the Arch Collaborative is helping other healthcare organizations throughout the world.
All right. Thank you, Everton, and we're glad to be here. Thank you so much for having us. So as Everton was talking about the Arch Collaborative, as we look at all the things happening around the world, whatever health system has deployed an EHR or an EMR or whatever you call it in your language, as we talk to those organizations, like Everton pointed out, 20% of the variability in the clinician satisfaction with the EMR comes from the technology itself. At some point, there has to be baseline functionality in place, things like documentation, ordering. You have to be able to do clinical decision support. But beyond that, once you've moved beyond these foundational elements, there's a lot more variability that comes for the end user experience from the organization and from personal aspects of the clinicians themselves. So I want to talk a little bit about some of those things that Everton teed up. So by far, the biggest, and this should come as no surprise, but by far the biggest factor that impacts a clinician's overall experience with their EHR is the education, the training. How much have they learned prior to adopting the system? How comfortable do they feel using the system? Now, how many of you would say, so I'll ask for a little participation, how many of you think that, a user that didn't get any training to start out will become proficient and pretty happy with the system over 5 years? Can you, if you give them plenty of time, will they be happy with the system given, 3 or 4 years? What do you think? How many people think that a clinician will be happy with the system after 5 years? Does anybody Can anybody understand me? I don't know. Nobody raised their hand. Maybe you guys all know. But what we've found is actually if you do not do a good initial implementation and training, if you do not have that good education up front for your clinicians, 5 years down the road, they will be no more satisfied with the system than they were when they initially started using it. That's a big deal to understand. You know, yes, there's a learning curve, but if you don't do some things to familiarize yourself with the system, to really learn the system, you're not actually going to get happier with the technology you're using because you never quite learned how to use it properly. Personalization, we'll talk a little bit more about that, but how much are you making this your own technology? How much are you making it help you or be an aid for you as you provide care to your patients? And then lastly, the culture or the governance, that's kind of the organizational aspect that really impacts the individual clinician experience. So we'll talk about those here as we go through it. So the first thing we want to talk about more is the training. So as we get into the education, we ask everybody, so as Everton pointed out, we ask about 20 to 25 questions as part of this Arch Collaborative to each individual clinician. When we ask them about their experience and ask them to rate it from strongly agree to strongly disagree in different areas. And so this question is around whether users say that their initial training prepared them well to use the system. And you'll notice that those that say they strongly agree that their initial training helped them well are about 70 points happier in aggregate. So we take all those data points and we add them together. If they answered everything perfectly well, they said strongly agree in all areas, that would be 100% on one side. If they were negative in every area, that would be negative 100. So as we look at it, the training one has a huge impact overall on the clinician experience. So there's a huge difference between those people that have strong training up front and the experience that they report overall when it comes to, do they think the EHR is helping them provide quality care, and do they have an overall positive experience with their EHR? And those that felt like they did not get a strong initial training. So what is a good amount of training? We find, as we've talked to people, the optimal is at least 5 to 8 hours of initial training, and sometimes you can even get a little bit more of a bump if you provide 8 to 10, somewhere in that range. So for some of you that are implementing, I know I'm sitting next to one that is, and there's others in the mix that are working through their implementation now. Just know that that initial training really sets the stage for your clinicians to be successful with the system in the long run. Now, the other thing to point out with training, not everybody that said they had good initial training is perfectly satisfied. So you'll notice some of the people are very, very satisfied, and you'll notice that there are some that said they had good initial training, but they are falling in that bottom half. What you notice, though, is that for all of those organizations that said they had good training in aggregate, nobody falls in that bottom quartile. So there are no real disasters happening if you provide your clinicians with some great training. All right, personalization. So this is another key thing for you to work through with clinicians. Now, all of you have smartphones. We heard Maren talk about that earlier today, about how much smartphone adoption is taking off. So as you have a smartphone and as you're using it, think about how you use and interact with your smartphone. Have you input a number of phones or a number of your contacts into the phone? Do you store email addresses? Do you store their phone numbers in there so that you can click a name and not have to worry about memorizing numbers or inputting that every time? Have you put apps on your phone? Have you put a browser on your phone to use it to look up maps and things? So think about what you've done to personalize your phone. Now, as we talk about personalization for the EHR, it's not quite that nimble sometimes, but there are a lot of things that clinicians can do to personalize it. Not just documentation macros to get data into the system, but there's a lot of ways you can personalize it to get data out of the system. And we find that the clinicians that spend the time to personalize their systems are much, much more satisfied with their experience than those that don't. So that's the key takeaway here. Encourage your clinicians to go and get involved. Encourage them to seize control of their experience and say, go into the system and set it up how you need it to be customized for yourself. Of the over 100,000 clinicians that have participated. About 40,000 of them are doctors. And of those 40,000 physicians, do you know how many said, and this is across all EHR vendors that we've measured, do you know how many of those 40,000 physicians said they have not personalized the EHR in any way? 50%. Can you imagine that? That would be, this half of the room hadn't touched anything with their phone. That's just shocking to me. 50% of these physicians haven't done anything to make their EMR their own. And because of that, they're having a much less of a robust experience. It's not helping them. It's not driving them and helping them fly, the plane if they were in the cockpit. So as we look at different things that people could do to personalize their EHR, you don't need to read through every single one of these, but these are different ways that people can personalize some of the EHRs out there. And the thing I want to draw your attention to is the percent adopting these. So as we talk about a difference in net EHR experience, these ones are giving people quite a big boost in their overall experience. This is a 25-point boost on a 200-point scale, essentially. So this is 16%, accounting for 16% of their experience. And you'll notice less than 40% in most cases are using some of these most helpful personalizations. So just as you're thinking through this, think of what you can do to get your clinicians involved. And obviously we have a lot more data on what are the best practices around these as part of this. But you're welcome to talk to us in the back a little bit more about that. The last thing I wanted to point out, I know I'm the last thing standing between you and lunch right now, so I don't want to go too long. But the one aspect organizationally that we look at as we talk to these customers that are using this EHR, they've rolled it out, they've spent millions and millions of dollars to get this technology in place. And they're faced with some challenges internally sometimes. And I know you guys are very familiar with this. You know about culture, and the change management process can be very difficult. So as we talk about culture and the thing that impacts the EHR adoption experience, it really comes from having a good rapport between IT and the clinical side of the hospital. This needs to be an overarching kind of top-down approach to the EHR. It shouldn't be just an IT-driven project. And I understand that as we talk to people, sometimes IT is doing the best they can. They've been given a task to deploy technology to digitalize the hospital, and if they don't have the support from the rest of the hospital, it can be very, very difficult. And we understand that. And so the challenge for you is to say, how do we overcome that? How can we help the clinicians really feel the trust with IT? When there's good trust, good rapport between those two groups, when those groups understand how each other works, and they understand that IT is supporting them and trying to help them be as successful as possible, that's where we see a big bump. That's the cultural piece that gives a big bump to the net experience for clinicians overall. So this is just the data behind what I was just talking about. So as we look at it, if you take a kind of a clinical IT and administrative approach to your rollout, we see the experience there being about 30 points higher to those that are just an IT-driven project. That doesn't mean you can't have success if it's just IT. It's just a lot harder. You're starting off from a more difficult spot to really get the full advantage and to really have that great clinician experience. So with that, I would challenge you all to think about what you're doing with your systems, how you're deploying the technology, and what you're doing to really get your clinicians on board to personalize the EHR for themselves, to get the necessary training. Those organizations that empower their clinicians and challenge them to take hold and kind of seize the opportunity and say, all right, figure out what you need to do to make your experience successful. Those that have done that have the best experience. We have a lot more information, and we'd love to share all of this with all of you. We're very grateful that InterSystems invited us to come. If you would like more information and access to some of the best practices that we have and want to talk through kind of your experience, I understand we'll have a table or something we can talk to you in the back. Please come to talk to either Everton or me. We're more than happy to share what we know and get in touch with you. We're happy to have a call with your organization.
And you should all have received a flyer on your way in with more information on the Arch Collaborator. There should not be any reason whatsoever that the InterSystems customers should be out of this. It's a great project for you to measure your EMR satisfaction and be on a path towards your digital transformation here in Southeast Asia. Thank you so much.
Thank you.